There we are. Thank you. Thank you, Katie.
Thank you, Karen. We're so glad that you're here and bringing this voice to the conversation. You will all, just a note, you will notice I started recording. This is not going to be posted on our website. It's purely for our note-taking purposes. We've scheduled 2 of these meetings with this group because we wanted to see how it goes. If it turns into a coalition, great. If it's just 2 meetings, great. But just appreciate that. Just wanted you all to know what this is for. Thank you. Denise Gee.
Hi everyone, I'm Denise G with the wonderful program, the WIC program, along with Kiran Saluja, and all of the above for my reason for being here, as well as being extended the invitation, so I feel a bit of a crasher. But I love being connected. I love Google, and I would love everyone else to be able to have that. I don't think that it should be where only certain folks have access to it. So equity, access, and for all to be able to have strong broadband as well. Thanks.
Absolutely. Thanks for being here, Denise. David. Oh, I think you might need to unmute, David.
Oh, sorry about that.
There we go.
David Panish, California Health Policy Strategies. We've been doing some work with Partners in Care Foundation, which provides a lot of home-related services for people who are seniors, dual eligibles. We asked them to do a survey. I'll put some of this in the chat, but we asked them to do a survey of some of their MSSP people. 50% had no internet access. 70% did not have a device that could connect to the internet. 73% didn't have access to a device with video. And part of this was, we talk about the expansion of telehealth, but in the real world, particularly for seniors, and I guess I'm getting close to being one now. I mean, it's hard to keep up with the technology, but the ability to pay for the premiums necessary for broadband make this really sort of a moot conversation for this population, who are the ones who could benefit the most from having access to it. So, I think it's particularly in the context of CalAIM, it's perfect timing. I really appreciate Katie and ITEP stepping up for this. So that's my initial pitch for the conversation. Thank you.
Thank you, David, and just appreciate your work in the space and generally David's work. David has been a longtime health policy person in this space, in the legislature, covered California, et cetera. So his big thinking ideas are absolutely welcome at this table. And so David, since you're working in the older adult space, I would really like you to meet one of our key colleagues who has just brought so much to this conversation in LA. Drum roll, please. Deanne Cuellar, please go ahead and introduce yourself.
Thank you so much, Katie. Sorry, I'm at a place that's a little loud, but I'll speak really quickly.
Okay.
My name is Deanne Cuellar. I am part of the Institute for Local Self-Reliance, and I serve on the Community Broadband Network Initiative team, but I come from tech equity work going about a decade. I also have spent the last 3 years until really recently working at this intersection of aging and technology, and rolled off of a telemedicine research study here in San Antonio, Texas, that used technology to measure social determinants of health, specifically social isolation, and seeing if we could extend the lives of older adults that were experiencing social isolation pre-technology. And the one number for sharing numbers I like to share with people about the digital divide in older adults is from our findings of that research study with the United Foundation. 80% of the people who lost their lives to COVID the first 2 years were over the age of 55, 80%, and 42% of those people did not have access to the internet. So it's from that research study that we started talking about the digital divide and digital vision as social determinant. And thank you, Katie.
Yeah, absolutely. Thank you, Deanne. I think something that we've noticed in these broadband conversations has been folks from out of state coming to California and sharing their expertise with us. And it's just been incredibly helpful. I can't say enough about Deanne's work specifically in health and with older adults and health equity, but also her team has been in this space for a couple decades, and Institute for Local Self-Reliance is known nationally in the broadband and digital equity space, and they've just been an incredible resource to us. So I'm going to let if you all want to connect with Deanne, I would encourage you, and some of her team's information is in our resources section of our presentation today as well. Thanks, Deanne. Let's see, Stephanie, please go ahead.
Hi everyone, I'm Stephanie Thornton. I'm the Senior Healthcare Policy Analyst with Community Health Councils in LA. For those of you who I don't know or don't know us, we're really involved in health navigation, outreach, and enrollment work in Los Angeles. So like has been shared, 2020 really highlighted the high number of families that we had been working with in South LA for years in person and at community sites that lacked adequate internet access. And then I guess just also from a coalition side, CHC has convened LA Access for a number of years, so would be excited to talk more about how to align with other coalitions that are in the area as well, or expand the group that we're reaching out to.
Stephanie, thank you so much for being here. I know you come to our LA Health Collaborative, but I've known CHC's work for years and would love to think about how we can support LA Access in that work and connect. So thank you. Charmaine, please go ahead.
Good afternoon, everybody. Charmaine Dorsey, licensed clinical social worker. I serve as Director of Patient and Social Support Services for Department of Health Services in LA County. Really thankful that this issue has been highlighted, right? We talk about this, these things existed for our communities for a very long time. So thankful now we're coming together with these conversations. We've had some discussions internally across our county departments in terms of how to best intersect what are all the things happening. And what I'm hopeful about with this group is similar, where we say, what are the things that are available? How do we do this well together? Because we're serving, the communities together. And so really thinking about this, certainly from a, telemedicine perspective, right? Like lots of work in that space, and knowing that there's some challenges around both device and broadband. Well, all three: device, broadband, and health and literacy of technology and health literacy, but also thinking about even beyond that, right? Like we also are connecting folks to the services in the community. So WIC and different things, right? And so how do we do that well? And how do we ensure that they're able to access those type of services? It's a health equity issue from my perspective, and a inclusion access, the whole EDIA perspective lens. I think, someone gave the example that, you can do all these services online, but if you have someone who doesn't have that ability, then they're at a little bit of a disadvantage in some ways. And so really trying to bring that together. So thankful to be with all of you thought leaders in this process, and thankful to be part of this conversation.
Yeah, Charmaine, thank you so much for your leadership and partnership at the county. It's great. Ahmed.
Good afternoon, everyone. My name is Omid Taloui. I'm the Vice President of Innovation at Elevance Health. Elevance Health is the rebranded Anthem. In case you're wondering, you've never heard that name before. That's
I definitely just Googled you, to be clear.
Yeah, it's as of 2 days ago. Really, first, I'm just so impressed hearing these introductions, and really grateful for the work that all of you are doing. We spend a lot of our time on the innovation team just innovating in digital and virtual care, identifying new solutions that can help families and folks living with chronic conditions get access to virtual care, et cetera. But those things are only innovative if they're really supporting and benefiting everyone in society. And we feel that as we see this exponential growth of virtual and digital health, if we're not making investments and focusing on bridging the digital divide is just going to get bigger, and we're going to have a bigger kind of chasm between those that have access to high quality care and those that do not. And so on the innovation team and in Elevance more broadly, we're very much focused on figuring out how we can, through private and public partnerships, help to bridge that digital divide and make sure that everyone has access to high quality care. And there's some work that we've been doing that hopefully we'll be able to announce soon to that end, and very much look forward to learning from you all and partnering with you to bridge the digital divide and make sure everyone gets to be a part of the digital health revolution.
Wonderful, thank you. Welcome, and thanks for letting us know about the rebrand. Really excited to hear more about the work that you all are doing. Stephanie, we'll continue with the Elevance Health. Stephanie Fiore, sorry.
Can you hear me okay?
Yep.
Having audio issues today. Great. So Stephanie Fiore, also with Elevance Health, on the public policy side. So what I'm doing is tracking various digital health policies, including digital equity and broadband, to see what we can either further support or move forward. So things I already saw in your layout today in your slide deck, things like the ACP and the NATIA broadband equity access and deployment provisions, and different things to help our footprint states, but also our members, and where the healthcare industry can come in and advance existing federal initiatives. So thank you for having us.
Wonderful. Yeah, absolutely. Thanks, Stephanie, for joining. Amanda.
Hi, good afternoon, everyone. Amanda Clark. I am with the SafetyNet Institute. We're the program arm of the California Association of Public Hospitals and Health Systems, CAPH. It's a mouthful. In all transparency, I wasn't, due to scheduling, able to join the statewide meeting this morning, but I'm hoping to learn from you all for LA today. You know, I would echo some of what Charmaine shared in that, you know, we're really focused on doing a lot of telehealth capacity building and, you know, building all this stuff out on the healthcare services side. But if people don't have broadband or devices or, you know, the health literacy to be able to access those things, then we have a big gap and divide there. So that's why I'm here. I'm hoping we can work together. Looking forward to it.
Thanks so much for being here, Amanda. And as Amanda referenced, we actually have two groups going on this. We have a statewide group made up of folks who work at sort of the statewide advocacy level. And since LA is doing so much in this area, you have a very strong local initiatives and local presence. We wanted to convene an LA focused one as well. And Amanda, we know you have members in LA, so I think it's absolutely appropriate for you to be here. Don't worry about that. So speaking of folks very active in the LA digital equity cohorts and work, I'm going to go to Lily Dorn with CCA LAC.
Thanks, Katie. Great to be here. Good to see a lot of faces, familiar faces, and meet a lot of you on this call. Appreciate this convening. I'm Lily Dorn. I'm part of the Community Clinic Association of Los Angeles County. We represent clinics and health centers across LA County. And, you know, we've been engaging with, as Katie mentioned, the state coalition, the California Digital Equity Alliance, and then at the local level as well. And really, I think, you know, as all of you have said, you know, digital equity is integral to health equity. And so we certainly believe that our clinics, as advocates for the patients and communities they serve, are an important voice in the digital equity conversation, and really look forward to elevating the value of connectivity, especially as it relates to telehealth and getting access to really important health services and benefits. So really grateful to be here with you all. And I know Joanne Priest is also on the line, for our Director of Government Affairs.
Yeah, thanks, Lily. Go ahead, Joanne.
Hi, everyone. Joanne Priest, yep, Director of Government and External Affairs with CCLAC. Not much to add. Lily's in the driver's seat on this for CCLAC, so I just wanted to listen in today, but happy to be here.
Wonderful. Thank you so much. Really appreciate your engagement and partnership on this. Allison.
Hey, Katie. Thanks. Hi, everyone. Allison Barnett with HealthNet. I'm the Senior Director of Government Relations. And we're on today because it's one of the big Medicaid managed care plans and one of the two plans in LA. This is a very important thing for us because this is how we want to be able to make sure our members are served. And we did a lot in telehealth at the beginning of COVID and are still innovating and looking for ways to serve our members and ensure access to these things. We have some great data on the subject, can associate some of my comments with Omid and Stephanie. By the way, I'm an Anthem alumni and I don't know that I'll ever get used to saying elements. And so forgive me, I'm going to slip on that a lot. But I just think, you know, this is how we have to meet our membership, and with the implementation of CalNAME and other things, and some of the proof we now have about how effective telehealth can be for reaching especially the rural communities. We just really need to ensure that these people have access to the technology they need to service them. And so we're looking for ways to be very supportive of policy efforts and things like that, similarly, where we can help move the needle and educate on why it's so important. So happy to be here today and see all of you.
Thanks so much, Allison. Really appreciate you joining us. And just a note, you know, I know several of you have work that you've published on telehealth or other things. If you have links that you want to drop in, if you have fact sheets, et cetera, feel free to drop them in the chat. We'll save the chat. We can make those available to the group afterwards. Definitely, please feel free to use it as an information sharing place. Let's see. I'm going to go to Maria.
Katie. Thank you, everybody. I apologize for being off camera. Maria Lemos with Visión y Compromiso on our network of promotoras and community health workers. And as you know, through the pandemic, through every other time, our community has less access to broadband and technology. We think it's really important, not just for from education to healthcare to access to information, but also in terms of equity and work, the workforce piece. Promotoras, community health workers need to be more engaged and knowledgeable about technology. Certainly training in technology is important for employment. So we've been working on that and also helping with youth in terms of the amount of education that's been lost over the last 2 years, and how can technology help that, since it doesn't seem like we're going to be in place fully at the moment. And then working also with aging, which is interesting because we have an aging and death and dying project that we just started looking at how that can help. I was at a conference last week and someone presented an option. It was a robot, and the robot had like an iPad in front, and that robot with the iPad communicated with a patient. I did not really like it because I think it was an opportunity. It was a technology perspective of how to interact. This was with a sick person and how to help them feel better. And I must say the language was good, the communication, the sound, and they even presented it in Spanish. But I also want to caution the technology doesn't take the place of real people and real activities. And that's when we look at, that's an issue in particular for telehealth, as it's going to continue to be present in our lives.
Absolutely. Maria, thank you for being here. You know, we've heard LA County is working on some digital navigation programs, and they're very excited about the Promotora model, as well as leveraging other community health workers, some of those employed by LA County and others in the community. So thank you so much for being here. I really want to make sure you all are connected in, because we know you're probably already doing a lot of this work on the ground. And just for those looking at the chat, I dropped in a few ITEP resources on these, including a community health workers fact sheet and a broadband for health basics fact sheet, in case you're looking for that.
Thank you.
All right, just a couple more introductions. I just wanted to take the time to really let everyone know who's on the call, because I think several of us are meeting each other for the first time, so we're almost there. Si Ping, please go ahead.
Hi, I'm Siping Chow. It's been a while, but it's nice to see you, Katie, and
Yeah,
I see
you
some
too.
other familiar faces too. I'm from the National Office of Community Health with Kaiser Permanente, and I work on social health member initiatives. We work on different social health domains, and one of them is digital equity. And just in our work, you know, we understand that digital equity is and broadband access and internet access is really a social determinant of health. So it's not only just that folks need internet access to access service, but you need internet oftentimes to access different services such as food and, you know, all the different social needs that there are. Just in our membership, we have surveyed them, have found that there's at least one social risk factor in our membership. 2/3 of our members have that. And nearly half of our members are experiencing financial strain. So we really want to connect our members with resources. And even though I work for the national office, so much is happening in LA, and I found the first it was the digital equity convening that you first brought together experts. That was really helpful. So I thought, you know, there's so much more to learn, and was excited to be a part of this. So thank you very much.
Wonderful. Yeah, thank you. I'm so glad you joined today, because I think there are, well, you know, you'll see there are so many aspects here. And as you can see, it's not just a California initiative. It's national. I think this is the one area where we've been surprised, but folks are engaging nationally, folks are engaging at the state level, and it's a lot of the same people. So pretty exciting. All right, let me see. Claudia.
Hi, everyone. My name is Claudia Echeverria, a policy analyst at Community Health Councils. Stephanie, who you heard from earlier, is my colleague, and she shared the invitation with me. I've actually been following some of the policies at the local and state level, aimed to closing the digital divide. So really happy to be here to learn more about the work that everyone is doing around this topic, and just really interested in that policy advocacy work.
Thanks, Claudia. So excited to have you here. Jody.
Hello, I'm Jody Wingo. I'm the CEO for the Community Health Association Inland Southern Region, also known as CHISER. We are a sister consortium to CCALAC, representing community health centers in Riverside and San Bernardino counties. So Katie sent me the invite and allowed me to crash your LA party from San Bernardino today, and I appreciate it. I would just reiterate everything that everyone has said, and we have particular concern for access and equity in our most rural areas, of course. But everything that everyone else has said, I would just reiterate. And just thank you for allowing me to be here and listen in.
Absolutely. Jody, thank you for joining. We know that in some ways borders are very porous. So we had such an engaging conversation on our Inland Empire Health Work Group talking about CalAIM today that actually broadband came up, and Jody and a couple other folks said, we'd love to know more. We said, great, in an hour, we have a conversation that you can come and listen to. So Jody, thanks for making space in your day to chat about this. I think we have two more. Dr. Nana, please go ahead.
Hi, good afternoon, everyone. Sorry to jump in there a little bit late. My name is Dr. Nana Afolanin. I am an ER physician, and I am the founder of Shared Harvest and the My COVID MD Initiative. We are a community-based mobile and pop-up clinic that is also working virtually to create a public telehealth platform. I echo what everybody is saying. I had the pleasure of working with ITEP and meeting ITEP through the CCF workforce on digital equity. And our 4 health equity initiatives on digital health, financial equity, and access to education, equal access to education by addressing the student loan debt crisis. Our new hyper focus, given what we learned during the pandemic, is focused on strengthening the medical pipeline. We really understand that in order to really expand access, you got to figure out who are the people who we're relying on to get the access going. So Shared Harvest, we just dropped a film, a little shameless plug, but the film is called I Am Not Your Hero. It's a deep dive on the psychosocial, the psychological and social ramifications of the pandemic on BIPOC providers. And it looks at suicide being the highest rate among physicians. It talks about other issues for first generation medical providers as well. And we are starting something called Project Recess, which is to pay off $23 million in student loan debt relief for our frontline medical providers. We, like some of the team members on here, just applied for a grant. If we get it, we will be paying $10,000 to train community health workers, about 75 of them over the next year. So as you can, Shared Harvest believes like the only way we address these divides is to strengthen the medical pipeline in terms of providing wellness initiatives and options to be able mental health services for providers, paying off their student loan debt, frankly, and then also keeping them in the pipeline to continue to serve our communities in the ways they know they can do, and to support them in doing it. So thank you. And I love being part of this group, and ITEP is amazing.
Thank you. And Shared Harvest is amazing. It's definitely a little love fest here for those of us involved in the digital equity space with CCF. So wonderful connection there. And feel free to share, if you have a link to that video, feel free to share it in the chat, please. And I think last but not least, Hannah.
Hi, everyone. My name is Hannah. I'm the Chief Diversity, Equity, Inclusion Officer at Children's Hospital Los Angeles. And I just got forwarded this from from one of our physicians, Jen Raymond, and I was like, yes, we need to talk about this because we are about to launch some strategic design around a digital divide. And we're opening a digital door for C.
Wonderful. Hannah, I'm so glad that Jen forwarded to you. We met Jen through my work on the Department of Healthcare Services Telehealth Advisory Committee, and her energy is incredible. What she serves, most vulnerable teens and does it through the use of technology. So very happy to have you here on her behalf, and I know she'll join if she can. So thank you all, and thanks for taking the time to actually introduce yourselves. I think we have a really exciting group here. I'm going to share my screen and jump through sort of the presentation to level set. We're going to talk a little bit about why health, what a role, what a health entity, whether you're an advocate or a facility or even a promotora, what you can do in this space. We'll talk a little bit about what LA is doing specifically, and then I hope we'll have probably 10 minutes at the end to have a bit of a conversation and think about what we can do next together. So I'm going to jump in here. All right. So the title of this presentation, I think, really sums it up for us: Health, Equity, and the Digital Divide. So we already did our introductions. Just a little bit of background about ITEP. I know you all have sort of met us here and there, but just to crystallize it for you, our mission, our vision, we really believe that Californians should have a fair opportunity to live their healthiest lives. And we seek a health system that is universal, equitable, accessible, effective, and affordable. And I think that those values really translate to the work that we're doing in the digital equity space. We have some policy priority areas. When we think about where we're working these days, coverage and access in keeping with our original mission. And then we are also moving into delivery system transformation, really making the delivery system work for people. And then the future of health, which for us is really turned into our connectivity and broadband work, telehealth, data, really the underpinnings of the health system and the opportunities presented with virtual care. So today, we're really hoping that we bridge that knowledge gap between healthcare and broadband and just level set, give you some vocabulary to use, and really focus in on this, what I think has really become the way that I think of our digital equity work. If you connect people up and you do virtual care and use it as a tool, hopefully we get better health outcomes. And I know that that's why many of you are here today. Really want to identify some opportunities for the health and human services sector to engage. There's a lot of opportunity, as we said, at every level, whether it's locally in LA County or in the Inland Empire or in Orange County, the state level, and also at the national level. And then we want to activate you. And I feel like that's a really strong word sometimes coming from ITEP because we tend to sit more in this convening and educating role. But there's just such an opportunity right now to activate you all and plug you into these conversations because the broadband policy community thinks that health and human services folks are engaged in the conversations. And by and large, they're not. I would say LA County is the exception rather than the rule. So why focus on broadband? I think everything that everyone said when you introduce yourselves, that it really sums up our goal, right? We really want to achieve the potential of telehealth and virtual care and what it can do for better patient outcomes. We really think it can make a difference in data exchange, in health access, and of course, in equity. I cannot take credit for this pyramid triangle. This actually really comes from our work with Deanne. Deanne really crystallizes it for us. There are 3 legs to this stool: the connectivity, the devices, and the digital literacy. And I think for us, it all comes around making it all equitable and affordable. So Deanne, thanks for that. We are socializing it and talking about it wherever we can. So I just want to talk a little bit about what is broadband before we get way into it and get really excited about it. This picture comes from some resources that actually are partners at the California Community Foundation, who's been leading a digital equity coalition that ITEP, CCA, LAC, and Shared Harvest, that's how we all really met and started working on this work together. We're sort of the 3 health organizations that have been engaging with CCF, and they have some really great explainers, and we have some resources for you that you can link to. But I love this picture. I'm definitely a picture person, trying to get my head around what do we actually mean when we talk about connecting people. There's this backbone long haul fiber. These are the things that connect us across the country and even across oceans. Then there's this middle mile, which are sort of like information highways, right? Think of I-5 or think of, I-99 up the Central Valley, big corridors of fiber and connectivity. And then there's the last mile. So the last mile connect into hubs on the middle mile network and actually bring that internet out into communities. And having buildings there in this visual is no accident. Health facilities, clinics, hospitals. We have several folks on here who are working, with community centers and the older adult population. You can serve as anchor institutions where you actually build fiber to the buildings and in infrastructure conversation, right? Not even just a policy or telehealth conversation, but you actually build fiber to these buildings and then you can get it out to your neighborhoods that might be underserved. So could be incredibly powerful. And then the question is, what kind of broadband do we need, right? We found this in an LA County Internal Services Department presentation to the LA County Board of Supervisors. You have a fantastic leader there in the director of that department. His name's Selwyn Hollins, and I know several of you already know him, but Selwyn has been an incredible leader. He and his team have created a Delete the Divide program. We have a link for you later in the presentation. They're doing really exciting work in LA County, and they are just so passionate about it. But for me, this crystallized as a non-broadband expert for me, what kind of broadband I need. I'm definitely in the high, medium to heavy category already, and we haven't even started talking about the future. And I imagine for healthcare, you probably need speeds even higher than this. Just to give you a sense of standards across the country, the FCC says that 25 megabits per second is their standard. That's where they want people to get to. You can see that you probably need a lot more than that. And frankly, wherever you're logging in from today, you probably have much higher internet capacity than even is on this chart. The last piece, I think, in the puzzle here is a broadband infrastructure conversation. And I feel like we don't talk a lot about infrastructure when we're talking, coming from the health perspective. We certainly come at this from a telehealth, virtual care perspective. But as I said, there's a whole infrastructure conversation in which health can engage and should engage because it goes hand in hand with something called digital redlining. And digital redlining is exactly what it sounds like, right? Here's some maps of LA County. The places where people have higher incomes, they have better internet. And where they have lower incomes, they have less internet access and capability. And that's really where anchor institutions and the equity argument and the opportunity to connect up the communities that you all are serving. You all are here because you are serving people who are generally enrolled in the Medi-Cal population or enrolled in WIC programs. We all know that those are means tested and these people are our most vulnerable Californians. And so I think that it's really important to think about these two concepts together. So why are we all of a sudden talking about closing the digital divide? And it's not just COVID, right? COVID, I think, really pushed us forward in video virtual meetings, right? I certainly wasn't using Zoom in this way prior to the pandemic, but there's some real money, not to be cynical here, but following the money in this context is really, really important. We have statewide telehealth flexibilities that are allowing us to pay for telehealth care in community health clinics like Jody and Lily and Joanne represent in ways that we just didn't in the before times. It was not allowed. And now there's real money, and California, unlike some other states, has committed to continuing those flexibilities and payments that will allow these centers that serve our safety net population to continue that work. So there's now real money in the Medi-Cal program for virtual care. It's very exciting in both urban, suburban, and rural areas. There's also the California Broadband for All initiative. There's literally $6.5 billion in the 2021 and 2022 budgets that are actually going to get us to build that middle mile infrastructure and connect up the state. And there are opportunities for health facilities to get some of that money and to participate in that process. But the regulatory agencies are not regulatory agencies that certainly I typically interact with. This is the Government Operations Agency, not the Health and Human Services Agency, not even the Department of Education. So it's the Department of Technology and the California Public Utilities Commission. So we have to look in different places for stakeholder and funding opportunities. And then finally, there were some major federal commitments billions of dollars that will be coming to the state from the Federal Communications Commission. You probably all heard of the FCC, but you may not have heard of the National Telecommunications and Information Administration, NTIA, and Stephanie Fiore mentioned them earlier. There's a lot of money coming out of these two federal regulatory agencies, and states have to submit state digital equity plans to access some of that money, and there are opportunities to engage there as well. So just to sum up the roles of health organizations, we call broadband the gift that keeps on giving. There are so many opportunities here to kind of go upstream in our health system to really engage so that we can do all of the exciting telehealth, virtual care, and data exchange work that we want to do. So there are local opportunities to engage, local infrastructure builds. You can become an anchor institution. I think if you're really interested in that, as I said, the LA County Internal Services Department is really leading that work. They're doing amazing things. And I think probably, you know, I put a link in the chat. If you scroll up a little bit, we had Selwyn come and talk to our LA Health Collaborative about a month and a half ago in May. So his presentation is in that link, but I imagine we'll bring him or his team back to talk to you here about what LA is actually doing. You also have a very active California Community Foundation that is focused on digital equity, and they would love to have more health participants. So if you're interested in that, feel free to reach out to me. Happy to connect to you, and I imagine we'll also have their team come and present to this group at our next meeting. They're doing really incredible work, and really from a community building and cross-sectoral perspective. And then you also have a group, they also have a statewide coalition called the California Alliance for Digital Equity Coalition. And then finally, you have some national coalitions, the Schools, Libraries, and Health Broadband Coalition and the National Digital Inclusion Alliance, both of which have incredible resources on what are anchor institutions, what's going on with the federal funding. They're really easy fact sheets to read. And then additionally, we talked a little bit about this during introductions, but there are opportunities for digital navigators, which are like community health workers. Very exciting there. There's also opportunities really in the short term to get people connected to the internet through something called the Affordable Connectivity Program. We're doing a bunch of work in that. This is a program that will give people who have incomes that are under 200% of the federal poverty level. Everyone on here serves those folks. You are automatically eligible for it if you are Medi-Cal eligible or WIC eligible, among other public programs. Incredible opportunities here sort of in the short term. This is a 5-year program and it gives people a $30 subsidy on their monthly internet bill, but you have to get signed up. And like all public programs, it's not that easy to get signed up. So we have a couple partners that actually have consumer helplines that can help people sign up for this. There are also partners that we have getting devices in the hands of people and families. And so we have some contacts who have discount devices that can be made available. And then, of course, that third leg of the stool, the digital literacy training. There are partners that are engaging into digital literacy. They already have trainings available. And so I think there are opportunities to leverage what's already out there and connect it if that's something that your organization is interested in doing. Just a note on state level broadband engagement. If you really wanted to get excited and engage at the state level, there are multiple opportunities to actually come and testify. There are also opportunities at the local LA level to come and testify. There are public meetings at the California Public Utilities Commission and through the Middle Mile Advisory Committee and the California Broadband Council, which are both run by the California Department of Technology. They desperately need people from the health community other than ITA, because we're on those calls saying, hi, remember us, we're in the health world and we need to be at the table. As I said before, they think we're already engaged because they say, well, we say that hospitals are anchor institutions. And when we ask them if they'd actually talk to hospitals or healthcare, they go, oh, well, no, but they're anchor institutions. They haven't talked to people. So we're really, there's so much promise in this. We really just want to connect the dots for them and bring people to them. And as I mentioned, there will be a state digital equity plan stakeholder process probably this fall and another opportunity. So if you're interested, I know you might work at just the LA level, but if you do have statewide partners who might want to engage in this, please let me know. Happy to add them to our statewide group where we're talking more about that specific type of engagement. Just a couple resources on where to learn more. These are the names of some of our key partners. Obviously several people on the line here are listed. This is just a subset of the partners, but one I want to draw your attention to is that group on the far right, LA Deal. It's the LA Digital Equity Action League, and they're actually funded by the California Public Utilities Commission to organize everyone in LA around middle mile infrastructure builds. So they're fantastic. It's a partnership between, let's see if I can say this, LAEDC, LA Economic Development Corporation. Yes, I got it right. And Unite LA. And they're fantastic. They have a digital literacy subgroup that has some health folks on it, but they would love to engage with the health community on this. They're doing great work, and they're reapplying again to the CPUC to get additional funding to continue the good work that they're doing. So they are a very real way to get involved immediately in the conversations around this in LA. So specifically for LA, I mentioned that you have a Delete the Divide initiative through the LA County Department of Internal Services. There's affordable connectivity program enrollment, which, you know, I know we've talked with Kieran and her team about connecting them to the Delete the Divide team so that they can roll out flyers and opportunities to enroll people in this program. As I said, there's LA Deal. There's also the California Community Foundation Digital Equity Initiative. And there's some local, hyper-local projects going on as well. And we highlight one of those called Destination Crenshaw in the Crenshaw neighborhood in South LA. The executive director of that is Jason Foster, and he's in the presentation as well from our LA Health Collaborative. So with all of that exciting information, I know that was a big download, and I know that yes, I will be sharing the PowerPoint. You actually should have it in your inbox already. If you don't, we can resend it out after this. And we're also posting the statewide version on our website. So not the recording of either of the meetings, but we are going to post that one just as a resource so we can share it out in case you have partners that might be interested in this type of, you know, high-level summary that has all of this together. So what do you all think? Is this something that you want to be engaged in? Would it be helpful to, you know, plug you all into this work? Or would you like us to, you know, I think something that we would like to do is probably bring people, I'd say specific, I'd probably start with the California Community Foundation and LA County ISD, bring them and have them talk to you, and probably LA Deal as well to talk about opportunities to really engage at the LA level.
Katie,
yeah, go ahead, David.
I think, I mean, it's a great summary. I think there's so much out there that it's important, particularly for those in Los Angeles. And I grew up in Los Angeles, so I feel an affinity there. You know, what's the problem we're trying to solve exactly? You know, rural communities have a different problem than they do in Los Angeles. And your maps kind of point out that, you know, is there really a backbone problem in LA, or is it a problem of I mean, I wonder how much of it is that people just don't have the money to pay for the premiums necessary to get broadband. So, you know, can we articulate or agree on what problems we're trying to solve? And then from there, you know, we can maybe try to develop some strategies that can address that.
Yeah, David, thank you so much. I think just to briefly answer it, the answer is you're right. There are different issues, I think, from a rural perspective versus an urban perspective, but we still know that almost 400,000 people in LA don't have connectivity, which I think is a really big number. And we're, you know, the LAUSD is finding that in a real way. They have some data that shows that even when they're in a service area, they still can't hook up people to internet. So just one very small example. So the answer is actually, yes, we have a middle mile problem, but we also have a last mile problem. And I think the next step would be to bring folks and say, this is where you can actually engage and be plugged into those infrastructure conversations, because LA Internal Services Department is hosting them. LA Deal is hosting them. They have multiple subgroups that are actually doing this, and they're talking directly to the folks who are creating the infrastructure projects at the California Department of Technology. So it's definitely good places to plug in and get more detail that way.
So I have one more thing to add, Katie.
Oh yeah, go ahead, Marissa.
To that explanation too, is that even when the infrastructure, the backbone is in place in Los Angeles, different to the rural areas where there might not be that backbone, sometimes it's an issue. You'll hear dark versus light fiber, and so sometimes the infrastructure is there, but it's not lit up, right? So it's not accessible to, it's not being used, right? And we don't have good maps for where that is, but that's another sort of infrastructure issue where having anchor institutions in a particular region where there is infrastructure, and then getting someone to light that infrastructure up is kind of like an example of another solution there. So I think even in LA, there is all of these different problems that need solutions.
Yeah, thanks so much, Marissa. Just in the interest of time, David, I'll come back to you, but I want to let Amanda and then Dr. Nana jump in. Amanda, go ahead.
Yeah, I kind of had a clarifying question, because you talked about anchor institutions a couple of times and how there seemed to be an assumption that if you're an anchor institution, then you're automatically engaged in the broadband discussion, but I had not heard about them spoken in that way. Like, so could you talk a little bit more about that connection?
Absolutely. So anchor institutions are actually a term that's created in federal law by the NTIA. And they are typically, community institutions, so schools, libraries, hospitals, county buildings, and they really sit in communities. So you build fiber to them, and then you can put a wire, a Wi-Fi tower on them. You could actually build fiber from those institutions out to different communities. But I think to your point, you're right. The NTIA sounds like 2009 as part of the American Recovery and Reinvestment Act in the last recession, actually included hospitals in the definition of anchor institutions or examples. And unfortunately, that memo didn't make it over to HHS. I certainly know in 2009, we were focused on getting more money for Medi-Cal to pay for Medi-Cal and the HITECH Act, right? And meaningful use and trying to get people off of paper records and putting electronic medical records in hospitals and clinics in the safety net. So I would say the broadband community has thought of hospitals in particular, but I also think they can think broader, right? Clinics, et cetera. They've thought about this for the last 15 years and they have not engaged with the health community, I think, in a meaningful way to say, come to us. So we're just starting some of those conversations. So don't worry, I had no idea what anchor institutions were until I read the definition.
Yeah, I mean, I can just share, I know that for many of our hospitals and health systems that are trying to become anchor institutions, because there's like a particular certification that's part of it. Broadband I've never heard broadband be part of the conversation and thinking about that identity. So it might be an opportunity to help, to introduce that as part of their concept, because they're moving toward that. Yeah. In the context of thinking about equity and serving their local communities.
Yeah, a different type of, this is a literal infrastructure anchor institution instead of an anchor institution in maybe a different way. Yeah. So yeah, we would love to continue that conversation. Just a note on hospitals though, the California Department of Technology actually has a vendor. Their name is CENIC, CENIC. It does stand for something, but it doesn't matter. They're referred to as CENIC. They're creating the maps for the middle mile infrastructure projects, and they actually already connect up all of the UC medical centers. So UCLA, and this is for you, Hannah, as well, might already be connected, but they tend to have an education-based network. So they have the K-12 schools connected, not all of them, but they're sort of a backbone for the K-12 schools, and they also have the universities of California. So they think that they have all of the hospitals in California, and even though they have some incredible institutions, we know that there are about 400 other hospitals that they could also tap into. So we're trying to bring that message to them. All right, I know we've got about 5 minutes left. Does anyone else have any thoughts or would like to talk about this? Any additional thoughts? Dr. Nana.
Yeah, I just wanted to quickly share anecdotally, the question that David raises important. And I think, where we talk about our own experience and blind spots around, if you have opportunity access, then it's hard to talk about digital divide if you aren't digitally, if you have digital access. Even us as physicians have to remind ourselves there's that blind spot. And the reason why Shared Harvest got involved is because that blind spot was really revealed when we started doing street medicine to offer telehealth services in the communities in South LA, where we brought our technology to upload and get people who were saying that they weren't connected to a telehealth provider through church parking lots and other community centers, and we couldn't get on, right? So he had created this, the thought, and I'm a Kaiser physician, ER physician. Kaiser had this rolled out this amazing approach to follow up with telehealth, and then it started collecting data about compliance. And we're like, well, there's got to be more compliance as a person doesn't have access to internet. So we're going to these spaces, and the community, these sectors, these hotspots that you saw on the map literally couldn't get connected. And so for us, it became real when we're like, we're barking at the wrong tree. It's not about Verizon versus Sprint versus this. There is a middle mile problem right here in South LA, and we can keep kicking the bucket, but what's gonna happen is what we tend to do in healthcare laws, we blame the patient. There's a compliance issue and we don't go deeper. And so I think I just want to share, like, this is why health providers, health partnerships, hospitals, we need to think deeper about our equity initiatives and get involved on the policy side, because they're directly impacted. And lack of data, lack of information at the community level is what further divides our health services and access to care delivery. And the last thing I would like to say about that is that we really have to get more community people at the table to talk about their experiences and be listening, and not feel like we're telling their stories, because that's where we saw that was missing. Again, our blind spot was because I'm like, oh, okay, I can just send an email to Verizon and say, hey, what's going on with my internet? But if I can't even get online, the person who can't get online, like, what do they do? And so I just wanted to share that as to answer David's question. It is different than rural, but it really gets into the heart of what is literally happening on the ground and who's telling their stories.
Yeah, thank you. I know we're right at time, so I just want to acknowledge a question in the chat. CPing, thank you. What is involved to be an anchor institution? That is a great question. It's what Marissa said, you become a hub for your community, but that actually means that we would need to get your probably IT and facilities folks to the table with the people who are running infrastructure. And in LA's case, it would be the LA Deal team. And we'd be happy to, if that becomes of interest, we'd be happy to connect you and start that conversation. And that's the same across the state. So I'm gonna go one more comment to Kieran, and then I'd love to wrap up. Kieran, go ahead.
So WIC doesn't own its own places, but since I specifically mentioned Pico Union, we've been in this building for over 25 years. The landlord is wonderful. There's also a health clinic there. If I wanted to get him involved in this conversation, I think I heard you say LA Deal. So that's why I lowered my hand. I think that's what we need to do, somehow put them together. Is there anyone on this call who can help us make some of that happen? Because
we can absolutely connect you into the folks who would be the right people. Yeah, so
just renewing a 5-year lease there, so I think you'd be very interested.
That's awesome. Yeah, well, and it sounds like a win-win-win. So that would be fantastic. Happy to connect you in. Thank you so much for that. And Maria, thank you. Let's not forget partnerships with CBOs who are critical resources in communities. Absolutely, they're absolutely a critical part of this work. So for next steps, what I'd like to do is anyone who's interested in connecting, if you really want to jump in and have a conversation with LA Deal about becoming an anchor institution, I think that that's a really great place to start. Our next meeting that we have on calendar is July 19th. We're going to invite the California Community Foundation, their Digital Equity Coalition, to the table to talk about how you could get involved with them and make sure you're connected from that perspective. We'll probably invite LA County Internal Services Department to talk about how you can connect into their Delete the Divide initiative. We keep sending people to them and doing lots of e-introductions, and they've been wonderfully responsive. I know Kieran and Denise and I had a conversation with them as well about the ACP program. And then I think we will find someone who can talk to us specifically about how you become an anchor institution and what that involves. And we've got some partners who do that work as well. So in the meantime, know that we're here. If you have any interest in testifying at the statewide level and interest in the Middle Mile Advisory Committee, happy to answer questions about that offline, but we can talk more about that at the July 19th meeting as well. Any last comments? Thank you all so much. As David mentioned, we got to define the problem here because the problem is so big, we can get lost in it. And so really appreciate you all working with us to level set and appreciate all the work that you all are doing. If you have other colleagues or other partners who might want to engage in this work specifically in LA or statewide, please send me a note. Happy to add them to our July 19th meetings. Both of those groups are meeting again on July 19th. So thank you all. Happy July 4th and talk to you all soon. Take care. Bye.
Thank you very much.
Thank you.
Thank you. Bye.